Dr. Danish, sir.
Thank you, Dr. Nishant and Dr. Akram Khan. It's really a very interesting and very good session indeed. We really want this kind of presentation from all the presenters. Whether you are a junior or senior, it doesn't matter much. What we require is knowledge and the experience. Thank you all. Good evening, good afternoon, and good morning. This is the 1640th day of continuous uninterrupted webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. RAMADEVI Ambadi, Madam. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in English, in Hindi from 7:30 to 8:30. We have an international session from 8:30 to 9:30, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic doctor, student, or a lover. The purpose of this forum is to take homeopathy to every household around the world. And it is the duty of every homeopathic doctor, as well as students and lovers, to share it. And when you see the videos, you just like it first, and then thereby more people will watch it. So hope all of you will be doing the same for promoting homeopathy around the world. Let me come to today's guest. As you all know, it is none other than Dr. RAMADEVI Ambadi. She is a legend from Kerala. She has having more than 50 years of experience and is a classmate of our president, Dr. Ismail Said. That itself shows how much knowledge she might have had in those days. She was under the guidance of Dr. Prakasham. He was one of the senior most doctor who has a well-known all over the world also. And such a person shared his knowledge to her, and she is doing every possible way to share to the our junior doctors here in our, not only in here, in all the homeopathy forums. And even if she has taken more than thousands of public awareness classes for public as well as students. And she is a person who was a winner of Swami Adiradas Award and that's a national award in 2021. And she is a specialist in infertility. She has more than nearly 2,000 cases in his successful cases in her kitty. And she, along with her friend, Dr. Shanda Chandran, she's also an active member here, has given lot of comfort to the families who were having no child, even after long treatment from the other side and different type of treatment. But they were able to give lot of children to those who visit there after so much of worry, so much of tension. But homeopathy has a solution. First of all, that kind of mother, she is always known as a mother of these children, mother, not simply she in Malayalam, we used to call her as Dr. Amma. That means the mother of doctor mother. That's what is mentioned in, we used to call her. And she has taken, she was the president of one of the most brilliant organization in Kerala, that is Institution of Homeopathy Kerala. There is a lady wing, and she was the president of that wing for a long time. And she has thereby share her knowledge in that way also. Anyway, let us proudly welcome Dr. RAMADEVI Ambadi to this session. And doctor will be talking. The subject of the discussion is an hour with Dr. Ambadi, and she is running a clinic named Ambadi Clinic at Parur, North Parur in Cochin. So whenever somebody comes to Kerala, you can visit her at Cochin, very near to our airport, international airport in Cochin. Thank you all. We welcome proudly to all the participants in this evening. You can ask your questions and when the time comes, and we can proudly welcome Dr. Ambadi ma'am to this session. Welcome.
Thank you, Dr. Danesh. Your loving and beautiful words fill my body with dopamine. I think it is saturated with dopamine. Thank you a lot. See, let me convey my love and regards to my parents, my husband, and Dr. Hanniman, and all stalwarts of homeopathy for giving me the knowledge about homeopathy and the persons behind this IFPH for the continuous non-stop how much 1,000 6,000 1,600
And 40.
40 days sessions. Thank you all. And above all, I convey my love to the Almighty. Today, we will discuss about the infertility. Now, about 15 to 20% percentage of couple are suffering from infertility. So let us discuss that topic today. See, 30% of the cause of for infertility, 30% is of female, and 30% is male, and 30% both of them, and 10% without any cause. Here, when there is no cause to detect, we should counsel the couple and ask them we should give them some advices, such as ask them to change their lifestyle. That is, ask them to go for a picnic tour. That alone, both of them alone, not the family members or anyone else. Because in one Malayalam movie, one scene is there that husband and wife is not having children and they were not having the privacy. So they decided to go for a trip, honeymoon trip like that. Then when they were ready to go, see, all the members were ready to go with them. Even the bedridden grandfather also was ready to go. It should not be like that. They both of them should go. Yeah, have you heard that? See, after going to Dargah, we got child, or after going to Malayatur or to Velangani or to Tirupati, like that. They used to tell. It is because of the hormonal change is happened there, and they would have they have good happy moments, and the result they got. So ask them to go for a picnic, and next ask them to that one thing. Then ask them to change their room for some time, for some days. If it is not possible, ask them to change to shift the couch to other side, the different side, or even that also is not possible. Ask them to change the lying position they used to. All these causes some changes in their behavior, and they will get, sometimes they will get result. I had 2-3 cases like this. Then we will discuss the factors affecting bone success. Here, main factors are structural causes of testicular, ductal, and penile, or endocrinological causes, psychological causes, and systemic causes. About the female factors are genital, endocrinological, immunological, psychological, and systemic. Here, let us see the genital factors of females: vaginal, cervical, uterine, tubal, ovarian, and causes destroying the vitality of semen. Here, first of all, let us see the vaginal factors. The vagina is the elastic muscular tube leading from the external genitalia to the cervix of the uterus in the female mammals. It is the most important organ of the female genitalia. It provides a passage for the penis during sexual intercourse, channels menstrual blood from outside of the body, and the birth canal for parturition. The vaginal orifice is called vaginal introitus. During the reproductive stage, the pH is acidic on the average of 4 to 5. Today, let us discuss about the vaginitis. Vaginitis is a term used to describe disorders that cause infection or inflammation. Vaginitis can be caused by different organisms. Some chemicals they are using for as cream or spray. Even unfit, tight undergarment also can cause this vaginitis. Even hormonal changes can cause vaginitis. Example, lack of estrogen in children and adults in aged ladies can cause vaginitis. In some cases, just a minute. In some cases, weakened immune system and infective from the sexual partners also cause vaginitis. Commonly seen are due to Candida albicans, bacterial vaginitis, Trichomonas vaginitis, chlamydia vaginitis, senile vaginitis, etc. The common symptoms are itching, burning, and vaginal discharge, which is different from the normal secretion. I told you now, vaginal discharge. Actually, one vaginal discharge it is acrid. Now, the in vaginitis, different from the normal secretion. It will be offensive as well as thick, pale yellow, and all. It will be discomfort or pain during urination and sexual intercourse also can be seen. General management includes adequate hygienic measures, avoidance of sexual intercourse, and sitz bath. Ask them to have sitz bath, putting some boric powder, borax or boric powder, and ask them to take 2-3 times sitz bath. Medicinal treatment includes relieving the distress by short-acting remedies like APs, aconite, and all, followed by constitutional treatment after taking detailed case to avoid other complications. Other complications means excessive urination is associated with vaginitis. Owing to short proximity to vagina, there is irritation, and due to short straight urethra in women, soon cystitis occur. Here, vaginitis causes cystitis and cystitis causes vaginitis. Here, we can see a vicious cycle. I told you now, we should give the acute the medicines to relieve the symptoms, itching and all, to relieve it. Acute remedies like aconite, apis, alsal, borax, canthidis, creosote, pulsatilla, sepia, etc. we can give. In senile vaginitis, I told you now, due to lack of estrogen, the children as well as old aged women will have vaginitis. For that, we can use acid salicylic, caladium, phagopyrum, etc. That is vaginitis. Next one is vaginismus. It is a condition which affects a woman's ability to perform sexual intercourse or undergo gynecological examination, insert vaginal tampon, or any act involving interference in vaginal canal. This is a conditional reflex similar to winking of an eye when objects come near to it. It makes penetration impossible or extremely painful. Usually seen causes are fear of intercourse pain, fear of tissue damage, that is being torn, fear of not being completely physically healed following pelvic trauma, fear of getting pregnancy, fear that pelvic medical problems may reoccur. Traumatic events, past emotional sexual abuse, witness of sexual violence or abuse. Anxiety or stress. General anxiety, performance pressure, general anxiety, performance pressure, previous unpleasant sexual experience, negativity towards sex, guilt, emotional trauma, or other unhealthy sexual emotions. Partner issue, abuse, emotional detachment, fear of commitment, distrust, anxiety about being vulnerable, losing control, etc. Childhood experience, overly rigid parenting, unbalanced religious teaching. That is, sex is not good, it's bad thing. And they'll be taught. Exposure to shocking sexual imagery, inadequate sex education. And also no cause also can be seen. There will not be, there will be vaginismus, but we could not tell any, we could not see any cause. Usually this vaginismus is two types. That is primary. No kind of sexual intercourse or penetration is possible in primary vaginismus. Secondary means previously they had normal intercourse, but later developed pain, usually due to fungal infection, trauma, during trauma during childbirth, or psychological causes. Here we have to rectify the psychological problems as well as the physical spasm. Here we can use effective medicine with which can give magical results. Belladonna, Berberis vulgaris, Cactus, Cantharis, Colophyllum, Simsifuga, Ophia, Ferramphos, Hamamelis, Ignatia, Lycopodium, Lysine, Murex, Natramore, Platina, Plumpermet, Pulsatilla, Silesia, Staphysagria, Thuja, etc. we can give. Here we can advise them to have sensate focus exercise. It is a kind of exercise. Ask them to refer in the this Google, and they will get the details about the exercise.
Yes,
Hello.
continue. Yes, continue.
Can you follow me?
Yes,
Am
yes,
I
no
getting
problem. No problem.
Okay. I will give you some tips which I have tried several times and I got results. First, insensibility of vagina, sepia. Sepia is the medicine. Heat and dryness of vagina, belladonna. Prolapse of vagina. The bearing down sensation in vagina is more during stool, so she is afraid to attempt for the passaging of stool. That is sternum. Cancer of vagina, creosote. Condylomata of vagina, bleed easily, phosphorus. Constriction of vagina during coition, vaginismus comes, cactus. And on touching also, they will have vaginismus in cactus. Contraction of vagina, creosote, sepia. Dryness of vagina, natamur, lycopodium, sepia, heloderma. Dryness of vagina during menses, graphitis. And dryness of vagina after menses, lycopodium, sepia. Excoriation around vagina. Usually we used to give nitric acid, but Ignatia works more well. And in Ignatia, there will be heat in vagina before menses. Acrid, profuse leucorrhea from vagina, ammonium carbon. In Ardeniticum, coition painful in both sexes, followed by bleeding from vagina. The coition will be painful for both of them, and afterwards, blood comes from the vagina. Here we can use nitric acid also. Cactus, constriction often caused or brought on by slightest contact. All these things I have tried several times and I got results. So you can very well use it. Caladium, pruritus vagina induces onanism. Here we can compare oregano and cinchomate. Carbolic acid, putrid discharge from vagina. It will be very offensive also. Rawness or soreness of vagina, causticum. Violent, corrosive itching of vagina, discharge, creosote. Discharge of flatus from vagina, chromium, lycopodium, nux mosquita, sanguinaria. Dryness of vagina prevents coition, lycopodium, natrum carbon. In lysine, sensitiveness of vagina is rendering coition painful. The dryness also will be there in lysine, but the sensitiveness is more important. Medorinum, intense pruritus of labia and vagina, aggravation thinking of it. Here we can give Helonius also. For this mind symptom. For natrum carb, discharge of mucus from vagina after an embrace causing sterility. Because the seminal fluid is alkaline and vaginal fluid is acrid. If the discharge is more, the semen will be washed off. And that's why it causes sterility. Acid nitric affects especially the mucous outlets of the body where skin and mucus join. Example, vagina. Acid nitric. You know, skin and mucous, acid nitric acts well where the skin and mucous membrane join. Here we can use acid mure also. Violent stitches upward in the vagina and prolapses of uterus and vagina. sepia. Discharge of blood from vagina every time the child takes the breast. Silesia. Here we can compare protentic. In protenting, drawing pain through the chest from breast to scapula of same side every time the child nurses. Nipple will be very sore and cracked in protentic. This point I got from the late Dr. Jayaram sir. Tuja, coition prevented by extreme sensitiveness of the vagina. Here we can use platina also. Coition prevented by dryness of vagina. Lycopodium, lysine, natrum car, natrum more. Here, if the dryness is more, we should ask them to take bath at least 2 times a day. Melandrinum impetio extending to vagina from back of head. Vagina will be closed with impetiginous crust, yellowish, greenish, brown in color. In acne, vagina will be dry, hot, and sensitive. During menses, eruption in vagina and vulva. Allium sativa. In alumen, chronic yellow vaginal discharge after patches in vagina. Here, colophyllum also we can use. Itching and burning in vagina, antipyrinum. Can you follow? Am I fast?
No, you are perfect.
Just a minute.
Yes, Dr. Ambadi is really a person who always sit with patients for a long time and to get what is the thing behind the problem. And she used to find the result out of it, and then she will be able to go to the right constitutional remedy. Along with, she used to prescribe these remedies also. Yes.
Antipyrinum, itching and burning in vagina. In Arando, they will be having vaginal pruritus. So if your itching will be there in vagina and they desire sexual intercourse in Arando. Oromet, great sensitiveness of vagina. Oromure natrum, ulceration of neck of womb and vagina, and leukorrhea with spasmodic contraction of vagina. Berberis vulgaris, vaginismus, contract and tendinous. Vagina will be contracted. Here, burning and soreness of vagina, neuralgia of ovaries and vagina will be there in or Berberis vulgaris. Ovarian pain also we can use this Berberis vulgaris. In boric acid, vagina is as cold as ice water, but in borax, the same at the same time, borax, the vagina feels hot. Boric acid cold, borax hot. Both this sensation causes infertility. Caladium, pruritus of vulva and vagina. Here we can use ambrosia creosotum. And vagina during pregnancy, caladium. Here we can use locally 1:12% of this hydrogen peroxide. Hydrogen peroxide 1% and 12%, 1:12 water. Ask them to wash it nicely. Calcarea ars, burning pain in vagina. Carbo animalis, burning in vagina and labia. Hemophila, pain in vagina and hot flashes. Simax, shooting pain from vagina upward to left ovary. Cineraria, feeling of pressure in vagina. Porphia, hypersensitive vulva and vagina. Convallaria, itching at vaginal orifice. Elapscore, itching of vulva and vagina. In Cophia, it will be hypersensitive. Elapscore, it will be itching. Ferrum iodide. On sitting, feeling as if something passed upward in vagina with itching and soreness. In ammonium part, acrid, profuse leukorrhea from vagina. In sternum, prolapsus of vagina. The bearing down sensation in vagina is more during stool, so she is afraid to attempt for it. I told you, no? Cancer of vagina, creosote. I told all these things. Acute vaginitis with dryness and heat in vagina. Sensitiveness is marked, followed by sulfur 201 dose, which will complete the action of aconite. Ambragisia, especially suited to lean, thin, aged, nervous ladies. Violent itching, which is aggravation by lying down. Bleeding from vagina during defecation. Apis. Vagina puffy and edematous with burning and stinging pain. Aggravation by hold application and ambulation by hold application. Here we can use Natamur also as a chronic of Apis to complete the course. Nitric acid. Soreness in the vagina with the burning ulcers, stitches of the vagina from within outward, itching, burning, swelling of vagina, വളർച്ച itching, discharge from vagina, especially after an embrace, causes infertility. Acid nitric. In borax, white, albuminous like the white of an egg. Thick, corrosive leukorrhea, mild way between the menstrual period, which causes infertility. Cantharitis, vaginitis secondary to urinary tract infection. Burning, scalding pain in vagina, which is amelioration by cold application and rubbing gently. Itching in the vagina. In cancer, itching in the vagina causes masturbation. Carbovage. Discharge of white or bloody mucus from the vagina. Fistula of vagina with burning pain is characteristic. Graphitis, chilly and constipated, obese person with a history of delayed menstruation. Vaginitis due to thin, white, excoriating leukorrhea, which leads to aversion to coition. Diabetes. Maxol, discharge of mucus and purulent foci from vagina, oblige the patient to scratch the parts followed by vaginitis. Maxol. One particular symptom is that the discharge is of a sweetish odor. Prolapse of vagina feel better after coition and washing with cold water. Itching, aggravation from contact of urine. Sepia, leukorrhea with itching in vagina, aggravation before menses. Discharge of greenish fluid which stitches. The discharge is very fetid, prolapse vagina. The leukorrheal discharge will be varied nature in sepia. Sulfur, burning in the vagina, producing great uneasiness. Severe itching, must scratch until the parts bleed. She has to bathe the part several times in the even in the night. Senile vaginitis due to estrogen deficiency, we can use caladium, fagopirum, acid salicylic, alfalfa, Aristolochia, clematis, etc. In vaginismus medicine, cactus, plumbummet, platina, pulsatilla. Vaginismus during coition, cactus, argentiniticum, lysine, natramur, sepia. Vaginismus prevent sexual intercourse, cactus, staphysagria. Some more tips can be, I will tell you. Vaginitis, medorinum, pulsatilla, thuja. Vaginitis with burning discharge. Borax, calcarea carb, calcarea sulf, creosote, pulsatilla, sepia, sulfur, acid nitric, thuja, caladium. Intense burning in vagina, Pulex. Herpes on vagina, Robinia pseudo. In sanicula, there is a sensation that they feel that this vaginal introitus is large. That feeling is in sanicula. Pruritus vagina, scrophularia. Vaginal cyst, Silesia, Lycopodium, pulsatilla, rhododendron. Spiraea almeria, dryness and burning in vagina with the pain during coition. Stanomet, pain in vagina, upward and backward to spine. Itching of vagina in the evening. Evening time will be, the itching will be there. Creosote. Itching vagina after coition, nitric acid. Itching vagina before menses, graphitis. During menses, conium. After menses, causticum, creosote. Voluptuous itching of vagina, creosote, caladium, lilium ticker. Nodules in vagina, agaricus, syphilinum. Pain centers in vagina from other parts, calcarea force. Pain in vagina from paroxysmal cause, Staph agria. Pain, aching pain in vagina before menses, I told you, no, graphitis, elapsed core also can be used. The aching pain in vagina before, during menses, calcarea carb. Burning pain and burning in vagina during and after coition, creosote. Periodical pain at every day at the same hour. Here we will think of cedron, but chelidonium acts more. Burning pain during and while sitting and walking, puja. Cutting pain in vagina during coition, Berberis vulgaris, ferment. Gnawing pain in vagina, lycopodium. Lancerating pain vagina, aggravation by walking, Berberis vulgaris. Pressing pain in vagina in the morning, pulsatilla. During stool, podophyllum. When stooping, lycopodium. Pressing pain. Pressing pain in vagina, morning, pulsatilla. Stitching pain in vagina on waking in morning, sepia. Pain in vagina from abdomen, creosote. Stitching pain during coition, Berberis vulgaris. Stitching pain before leucorrhea, umbraglycia. Stitching pain on standing and while walking, nitric acid. Polypus vagina, calcareaca, pulsatilla, teucrium. Sensitiveness of vagina, which prevents coition, lysine, platina, Staph agria, belladonna, thuja, sepia, silesia, Berberis vulgaris, coffea, creosote, natrum wood. Cirrus cystin vagina, rhododendron. Vagina swollen during pregnancy, borax. Vaginismus preventing coition, cactus, platina. For dryness of vagina, ferment also can be used. Edema of labia and vagina, amylation by cold application, EPIS. Vagina very sensitive and prevents sex, thuja, Platina staphylococcus. Venenosmus, cactus, plumbermet, platina. Hamamelis, Argenaticum, lysine, natramo, sepia. Voluptuous-like sensation in and coitus-like sensation in vagina, oregano, platina. Dryness of vagina, heloderma. Only this much I had written, Ganesh. Thank you. If anybody has got any doubts, they can very well ask me. If I know, I will tell.
Yes.
Dr. Santa also is there, I think.
Yes.
She will also help me.
Dr. Santa is also there. And as usual, you made a presentation on vaginismus and management of female sexual organs in disease. And definitely, some of the medicine mentioned here are very brilliant, excellent, result giving as far as from your point of view also. And those who want to have a question or want to have a chat with Dr. RAMADEVI Ambadi, please raise your hand, or you can ask your question directly also. Please see. Is there any question? Yes, there is nothing written in the question session. Yeah, so you can narrate a case of this, but Dr. Rituraj, do you want to ask anything? Please unmute yourself, Dr. Rituraj.
Good morning, good evening, ma'am. Ma'am, what was the medicine for herpes in vagina? One was Robinia and what was the other?
Robinia and herpes, no? Let me see. He's confused. Should be correct, no?
Something like Pulex.
Purex.
Purex, it's Murex or Culex?
Purex. Pulex. It's a type of insect, I think.
Okay, thank you, ma'am.
Okay.
How to correct anovulatory, Dr. Swapna Chandra? Dr. Swapna, you can directly come over here and ask how to correct anovulatory cycle. That is the question.
Hello, who is asking?
Yes, yes, yes.
Okay. Let her come in the video. Let me see her face. I can tell you directly, no?
Dr. Swapna Chandra, please raise. Yes, Dr. Swapna, you can ask the question directly. Yes, please unmute yourself. Please. Okay.
Ma'am, there's a patient, I have few patients who don't have menses even after 6 months. They have to take allopathic medicines, hormonal treatment, only then they are getting the menses. So once, for one patient, I tried with natramotenum and she got menses on the very day. But next time, it is not working.
Pardon? For this anovulation, this amenorrhea during this anovulatory cycle, you mean?
Yes, ma'am. 6 months, they don't have periods. Even after
If,
6 months,
see, you give Lycopodium tenum 2 doses followed by Gossypium tincture. If you are not treating for infertility, you can very well give these medicines, Gossypium tincture and Pulsatilla tincture. 10 drops.
She's a 20-year-old girl.
20-year-old girl.
Not married.
Then you can give Lycopodium tenum and Gossypium and Pulsatilla tincture. If the Lycopodium is not acting, if she has got any history of cancer or diabetes, family history of cancer or diabetes, you can very well give carcinosin tenum instead of Lycopodia or after Lycopodia.
Okay. Thank you.
Dr. Swapna Chandra, do you made any examination? You have whether she is having PCOD or
PCOD and all.
Yes, ma'am. PCOD ഉണ്ട്.
yes, PCOD is there.
Then you can very well give this
Yes.
lycopodium first test, tandem 2 doses followed by gossypium and pulsatilla. Then and for this annuity cycle for normal and
Folliculinum, okay, madam.
for
Folliculinum, estrogen, anything like that. We can
He
give.
said you can very well apply, but you should see the result. If it is decreased, we
Okay.
can apply. Otherwise, we don't want to apply, no.
Yes, ma'am.
Okay.
Decrease,
hormonal test.
Anya.
Hormonal
What
test.
is decrease, ma'am?
Hormonal, you do the
Okay.
hormonal test.
Okay, ma'am.
Then we
Okay.
can very well understand, no.
Okay, ma'am.
Okay, now it's the time for Dr. Srinivas to ask his question. Dr. Srinivas.
Madam, ovulation time, the patient's endometrial diameter is 6 to 7 millimeter, and it is been seen that the patient's AMH is very less. So, what medicine can help in raising the AMH and at the same time increasing the endometrial diameter to say 9 to 10 millimeters?
I'll give you one protocol.
Dr. Asha Varghese, you can add something here. Please unmute. Please unmute. Please unmute.
Yeah, am I audible, doctor?
Yes, yes.
Yes.
Yes, yes. Mama, hi. Okay.
This one, there.
Jaisalmer, yes. We are on a holiday. Best medicines for increased bleeding, as in profuse bleeding during menses.
Trillium, hamamelis, and all you can use.
Bovista.
Hamamelis, trillium.
Yeah. Okay. Okay.
If clots are present, you give Ciclicor.
Ciclicor. Okay.
Yeah.
The thing is, I have the best doctor at home, like, so if whatever, I need to know, I'll just get it directly. But I wanted to ask you some question.
Okay.
Doctors, I know the effort she's putting in, and I know it's very exhausting for her, during this time. And but still, I've seen how much of effort she puts in for the promotion of homeopathy, IFPH, and all the classes and everything. Thank you, ma'am. Bye.
Thank you.
Bye.
That was a
Okay.
doctor mom conversation. Yes. Yes, now Ambadi madam, you can go ahead with the answer.
See, what this one of my friends, Dr. Ramakrishnan Palakkad, has given one protocol which we have tried and I have got result. For low AMH, X-ray 200 and Nux mosquita 200 on alternate weeks. Here, the doctor who asked me the question,
Dr.
whether you hear it or not.
Yes. Yes, Dr. Srinivas. Please unmute yourself. Yes, Doctor. Please
Can you hear?
Yes, I can hear you, ma'am. I can hear you.
Okay. You try X-ray 200 and Nux mosquita 200 on alternate weeks. On other days, cactus tincture 5 drops in the morning around 7 a.m. in warm water and 10 drops of ashwagandha tincture at 9 a.m.
Okay.
9 a.m., 2 p.m. and 7 p.m. daily. Except when giving X-ray and Nux mosquita. Check the AMH level once in 3 months only.
Okay, okay, okay.
During periods, you should avoid all these medicines. In that time, you should not give. After period only, you should give. But you should understand the cause, the reason for low AMH. Then prescribe. Because repeated IUI, IVF, etc. can cause low AMH. Here we can think Stabsagria.
Okay, ma'am.
Good evening, madam. Yeah, yeah.
Yes.
Madam, yeah. Only two small questions. Number one is like the previous query was there for absent menses of a 20 years old girl. There was a use of sarcodes, madam asked. So how rationally we should use sarcodes, like U4NM, then testicle? Because what happens, our science is depend on the signs and symptoms. So if they are not there, why should we use sarcodes? That is the one query in the mind. So
if any defect is there, we should see the blood test. No, if the defect is there, we should apply. Otherwise, no need.
Exactly.
Here we can use one thing. The pituitary, hypothalamus, pituitary, ovarian axis is there. The control every function of genitalia.
HPA axis.
You can use HPA axis. You can give hypothalamus 200, hypothalamus pituitary 200, and ovary 200.
And secondly, what is the auxiliary line of treatment we should advise to the patient for all vaginismus cases in general?
Pardon?
What is the auxiliary line of treatment? Means how to take care except medicines. How should we guide them except medication?
Ask them to avoid sexual intercourse for till that they are all right. Ask them to avoid sexual intercourse and ask them to take sitz baths daily. 2-3 times they should take the sitz bath, and they should make some good rapport with the partner. That causes this vaginismus, no? That is, I told you, one exercise. That is, you should go through that. I don't know how to explain this one. Pardon?
Probably Kegel's exercise, did you suggest?
Pardon?
Kegel exercises?
Not Kegel. Another exercise is there. Just a minute.
Yeah.
Sensate focus exercise.
Okay. Thank you, madam, for your good explanation. It was really nice to hear you.
That is just the opposite partner should touch the part without provoking any other feelings. Then slowly touch the parts. Then they should act like intercourse without penetrating the penis into the vagina on the other parts and all. Like that. I don't know how to explain it fully. You just go through that. Sensate focus exercise.
We'll note down. Thank you, madam. Thank you, madam. We'll note it down. Thanks for explanation. Yeah.
Okay.
One question from Dr. D.M. Tiwari. What is the medicine for immature ovulation?
No, immature ovulation. Here also we can give hypothalamus, pituitary, ovarian, this one, that method of treatment. And we can give ovary, U4NM and all we can give, no?
Now I invite your friend, Dr.
My friend, Dr. Shanta is there. Shanta? Barita also can use.
Thank you,
my daughter has told Barita also can be used for immaturity. Sunday for immature ovulation.
Immature ovulation, you can have pituitary 10, then Barita 10, and for lecithin 3x will give you a wonderful result. Lecithin 3x and oleum jack 3x continuously you have to give, then that will give wonderful result.
Nutritional this one, Where?
Ah.
Lecithin and oleum jack.
Yes.
Pitupru 10 and Barita carb 10 that is once in 15 days. Then
Okay.
lecithin 3x,
Oleum jack 3x.
oleum jack 3x, and curcuma tincture. That will increase AMH quality, quantity, everything. That's this. If you don't have any hormonal imbalance, that means if prolactin is very high, you have to control the prolactin first. Then only you will have that. Or if that FSH LH prolactin ratio you should see that ratio. If prolactin high, you have to give medicine to reduce the prolactin. You can give borax to reduce the prolactin. And prolactin itself, you will get the medicine. And then that's it for an ovulation. And for AMH less patients, you can try this lecithin, oleum jack, curcuma tincture. Okay, thank you.
Thank you.
Thank you. Thank you, Chanda.
Now it's
Okay.
time to wind up the session. I invite Sri Abdul Salam sir to say vote of thanks to the session.
Okay, very nice presentation, Dr. Rama
Good evening. Good evening.
Ramadevi. Thank you for coming.
Salam. Such a
and-
long time we have seen you.
Yeah, thank you. And I'm thanking also you and all our well-wishers of IFPH. Thank you. Our next guest is ready there. Okay,
Okay. Thank
see
you.
you.
Thank you.
Dr. Ramadavi Ambadi and those who participate in the session and those who actively participate in the discussion also. Tomorrow we will have a session from Dr. Mani Singh Azad, and Dr. will be talking about understanding Binacro syndrome through the lens of homeopathy. With that, we come to the end of the day 1640. It's over to Dr. Mariamma John to moderate the Malayalam session. Thank you all. Hope all of you will join us tomorrow by using the same.
Thank you. Thank you.